When we don't have enough data available about a student, for example, if it's a recent arrival with interrupted educational experiences, then we have to look to the parent to try to get as much data as possible, and then we have to conduct a series of assessments and interventions to establish performance level and to determine what their needs are and how we can best help them close the gaps. I think that I would start by talking to parents and getting as much information from them about the child's development over time, any information they may have, even if it's not formal information, but their perspectives on whether the child was in school, whether they were consistently present for instruction, whether they saw any problems as a result of the schooling or problems in terms of their child's learning. So we want to get as much information from the parent. And then in the school context, I think we have to rely on instruction to get the data that we need to make decisions about what would be the best supports for this student. So you have to have an assessment that determines what skills they already have and what their strengths and needs are. And then you begin to provide instruction and monitor whether they are acquiring the skills that you're teaching, assuming obviously that the skill is being taught at the right instructional level. Because students who don't have disabilities are going to make progress with good instruction. Those for whom there are other factors in place will struggle even though you have high quality instruction. We have a process that we oftentimes use that we call dynamic assessment. So you take a skill that you want the student to acquire, you assess to see how much of the skill the student has, and once you've made that determination, then you actually teach to the skill, and then you assess as a follow-up to see were they able to acquire it as a result of the instruction, or how many different ways did you have to scaffold or adapt the instruction to help the student learn it. And so again, when students don't have disabilities, they will be responsive to that instruction. And so you can do a series of assessments to try to establish the baseline. And that's going to give you information about how core instruction needs to be modified to meet their needs, as well as what kind of supplemental intervention might be helpful to that student, particularly when you're talking about large gaps in their knowledge or skill base.